Hi, Dr. Marcia here, and today I want to talk about the difficulties that parents and young children have as we are entering into a possible fourth wave. In many parts of Canada and the United States, the fourth wave is already there, and in some places we are possibly heading in that direction. And that raises a lot of difficulties for parents of young children because the children are again not being able to socialize, not go to birthday parties, not go to fun events, or have their extracurricular activities. And the parents are frustrated as well because they don't like to see their children unhappy. It's not good for their children's psychosocial development to be so isolated. And it's also, what do they do with their kids, because the kids are there all the time. So there are basically two suggestions that I have in terms of how to help parents with these young children who are possibly having to enter into a fourth wave with more isolation and more restrictions. One of my suggestions is to make lemonade out of lemons. So parents can think of fun activities that they can do with the family and with their bubble so that the children can still have fun activities even though they might not be doing them with a wider group of children their own age. So families can take advantage of the fall by going walking in the park and looking at the leaves, collecting leaves, maybe pressing them. And if you have a backyard, parents can rake up all the leaves and the children can take turns jumping in the leaves, which is a lot of fun. Other activities is scrapbooking, crafts, going for bike rides with the family. There's a lot of parts of Toronto for sure where people can go walking and riding, and it's very, very nice, especially in this time of year. Another thing, of course, is having good heart-to-heart talks with their children about how they're feeling, because when children are frustrated, it's good to know that they can go to their parents and have conversations that are based on their level of education, their maturity level, and who they are as a person, and having these good conversations so that the children don't feel that the conversation is above their head, but also the children feel that they're heard and that they're supported. The second piece of advice I want to give parents is much more on the psychological level, which is how to really look at these difficult times. And there are a few factors that I would recommend for parents to bring in to their conversation so that the children really can benefit from this experience as opposed to just find it a big drag. The first aspect I think that is really important to discuss is for parents to say to these children, yes, it is a difficult time, to acknowledge the child's experience, not to minimize it, but not to exaggerate it either, just to acknowledge the reality of the situation. It is a hard time, and also say, but it will pass, allowing the child to recognize that it is difficult, but it is not permanent, that it will eventually go away and life will return to some semblance of normal. Not possibly exactly the way it was before, but that it will get better, it will improve. So parents can use that concept of the impermanence of the difficult times to help reassure children that it's not going to be forever. But also acknowledging that yes, right now it is difficult and we are making the best of it. Another thing that parents can talk about to help children make it through these times and build resilience and grit is giving them a sense of perspective. Having them really look at where things are difficult, but where things are not so bad. Thinking about the good things in their life, thinking about the things that are not so hard, not so uncomfortable, things that are going well even, things that are fun, parts of their life that make them happy, that give them joy and pleasure. And so if the parents help the child develop perspective, it can really help the child get through difficult times because they can see where they stand in the middle of all the difficulties. It's not as bad as maybe, some other person, maybe it's not as good as some person, but it's definitely not as bad as it could be. And an extension of this perspective is also having gratitude. So taking a time, maybe making it a dinner ritual once a week where all the family is sitting around dinner and everyone gets to say a couple of things that they're grateful for. So taking time to really focus on what we're grateful for really helps children be resilient because it helps them focus on the positive and focus on the good things in their life that they really are appreciative of. And another thing, finally, I would say that really helps children be more resilient is feeling that sense of community, that they're not in this alone, that we're all in this together, that their parents, their family, their extended family, their friends, their classmates, their teachers, the community at large, everyone is going through the same thing and they're not the only one who is having difficulties, and that other people are having difficulties in different ways than them, of course. You know, a 6-year-old school child is not going to be having the same kind of difficulty as somebody who is running a restaurant, for example, or who owns a small business. But everyone is struggling, everyone is having difficulties, everyone is going through a hard time, and having that sense of community and knowing that nobody is alone in this, that we're all in it together, can really help children be resilient. And an extension of this is being generous and being helpful to others. So if the family can think about ways to do for others, to be generous in the community, to be helpful in the community, to give to others, whether it's in charitable contributions or volunteer work, in whatever way they can, that will also help the child feel connected, feel like they're a part of something bigger than themselves, and so they are not going to get so stressed thinking about, why is everything happening to me? Why is this so hard for me? They will see that other people have difficult times too, which also goes to the perspective aspect, and they will feel empowered because they have a sense of something that they can do that's positive in these difficult times. Because when we can do something positive, when we can make choices to do something good for others, we have a sense of empowerment in a time where maybe we don't feel very empowered, we don't have a sense of control. Well, there's no such thing really as control, but we can always feel empowered, and we can always make positive choices. And being a part of a community and giving to others really does help us be more resilient in difficult times. So part of making lemonade out of lemons is taking these difficult times and seeing them as an opportunity for growth and development for children. And young children will not lose out by developing more grit and resilience today, because these are psychological tools that will stand them in very good stead in their young adulthood and in their adult life, because they'll be able to cope with adversity, they'll be able to deal with difficulties and failure and mistakes without feeling overwhelmed, and they'll have an advantage over other people who don't know how to be resilient in the face of adversity. This is Dr. Marcia Sirota talking to you today about how young children and their parents can learn to cope better in these difficult times as the fourth wave possibly is approaching or is already here in your community. Please stay tuned for more of my Moving into Autumn with Good Self-Care video series, and take care of yourself and your loved ones.